Welcome to this presentation on Bernard's discrimination model of clinical supervision. In this presentation, I will provide an overview of Bernard's model and explain the supervisory roles of teacher, counselor, and consultant within the framework. Understanding these roles helps supervisors effectively support the professional development and clinical competence of counselors in training. My name is TJ Finn. I'm a licensed professional counselor in Texas with a certification in neuropsychotherapy and a master's degree in human development and counseling. I am also currently a doctoral student in counselor education and supervision at Grand Canyon University. Clinical supervision is a structured, evaluative, and supportive process designed to enhance counselor competence while protecting client welfare. It includes professional development, ethical oversight, and gatekeeping responsibilities. Effective supervision strengthens clinical skills and professional identity. As you see on the screen, this model enhances counselor competence, protects client welfare, supports professional identity development, includes evaluation and gatekeeping, and aligns with CACREP standards. Bernard's discrimination model is one of the most practical and widely used supervision frameworks. It is considered discrimination because the supervisor discriminates between supervisee needs and selects the most appropriate role. The model emphasizes flexibility, allowing supervisors to shift roles depending on the supervisee's developmental level and presenting concerns. According to Bernard and Goodyear, supervision serves three primary purposes: administrative oversight, professional development, and gatekeeping. Supervision ensures that counselors in training are delivering ethical and competent services while developing clinical judgment. Within CACREP standards, supervision is foundational to counselor preparation and professional identity development. As counselor educators, we must balance mentorship with accountability, ensuring that supervision promotes growth while maintaining public protection and ethical integrity. The three focus areas, intervention, conceptualization, and personalization, guide what the supervisor attends to, while the roles determine how the supervisor engages. This flexibility makes the model adaptable across supervision modalities, include individual and group supervision. In the teacher role, the supervisor provides direct instruction, models techniques, and clarifies interventions. This role is particularly useful for beginning counselors who require structure and concrete guidance to build competence. The teacher role includes an instructional approach, skill development and modeling, corrective feedback, and a high structure for novice supervisees. In the counselor role, the supervisor attends to the supervisee's emotional responses that may influence clinical work. The goal is reflective awareness, not therapy. This role supports ethical sensitivity and professional growth. The role of counselor focuses on supervisee affect, explores countertransference, enhances self-awareness, and supports emotional regulation. The consultant role positions the supervisee as a colleague in development. The supervisor reduces directive instruction and instead facilitates critical thinking. Questions such as, "What are you considering?" or "What are your next steps?" encourage autonomy. This role is appropriate for supervisees demonstrating higher levels of competence and confidence. The consultant role fosters leadership development and professional identity integration. However, it requires accurate assessment of readiness. Premature use may create anxiety for less experienced counselors. The role of the consultant is collaborative partnership. encouraging autonomy, and promoting critical thinking. This role is appropriate when supervising advanced supervisees as well. As a counselor education doctoral learner, I will apply the teacher role by modeling clinical skills such as a suicide assessment, ethical documentation, and structured case conceptualization to strengthen supervisee competence. I will apply the teacher role when supervisees require structured skill development. For example, during suicide assessment supervision, I may model direct questioning language or demonstrate documentation standards. I will also provide structured supervision agendas to reduce ambiguity. This aligns with developmental supervision principles and supports early stage counselors who benefit from clarity and direction. I will apply the counselor role when supervisees demonstrate emotional reactivity or uncertainty. For example, if a supervisee appears overwhelmed after a high-risk case, I will facilitate reflective dialogue to explore emotional responses. I will also integrate multicultural reflection to examine how identity and bias influence clinical work. This strengthens ethical practice and emotional regulation while preserving professional boundaries. Using the consultant role, I will encourage supervisees to generate their own intervention strategies before offering feedback, fostering autonomy and confidence. In group supervision, I plan to use the consultant role to foster professional autonomy. I may ask supervisees to generate intervention strategies before offering feedback. Encouraging peer consultation within group settings supports collaborative learning and leadership skill development. This role models professional consultation as an ethical safeguard rather than a weakness. The teacher role is highly effective for developing foundational competence. Research suggests structured supervision enhances skill acquisition and reduces anxiety among novice counselors. However, over-reliance on directive instruction may inhibit supervisees' independence. Supervisors must assess readiness carefully to avoid fostering dependency. The counselor role strengthens emotional awareness and supports professional identity growth. Borders and his colleagues emphasize that effective reflection enhances supervisee development. However, supervisors must avoid crossing into the therapeutic relationship. Maintaining role clarity protects ethical boundaries. The consultant role is powerful for advanced supervisees, fostering independence and leadership readiness. It prepares counselors for licensure and independent practice. However, inaccurate developmental assessments may result in insufficient structure for struggling supervisees. Bernard's discrimination model provides a structured yet flexible framework for supervision. By intentionally shifting roles, supervisors promote developmental growth and protect client welfare. This supervision model remains highly relevant because of its flexibility and practicality. By intentionally shifting between teacher, counselor, and consultant roles, supervisors can meet supervisees where they are developmentally. As a counselor, educator, doctoral learner, integrating this model strengthens my supervisory identity. It promotes ethical oversight and enhances supervisee competence across modalities. Thank you for watching. I have included references to support supervision theory and application. Have a blessed day.